Welcome to Grief and Brief with Honeyford Sandcastles. This is Peggy. Today we are going to talk about how do we talk to young children about death and dying. It's a hard topic and one that they don't actually really teach anywhere. Uh, we don't really see that teachers get that information, or doctors, or nurses, or even childcare staff. Yet we know that grief affects a lot of little kids, and we want to be able to be there and help them. And there are definitely some better ways of doing things. So let's talk about that. First off, understanding what debt is actually the first task of grief and first task for kids and the first thing they have to figure out. And when they're really little, we're going to talk in particular about kids who are seven-ish and under. They are concrete thinkers, so they understand what they can see and hear and feel and touch and taste and smell, all those concrete senses. In the same way that when a baby is learning about the world around them, they might have a tendency to put the block or toy in their mouth, and they're learning about it through that. Those concrete senses are very real, and it doesn't, in normal childhood development, doesn't usually um, change until around 7 or 8 years old, where kids are develop into the ability to do abstract thinking. So it's normal for a little child to be a concrete thinker. And as they get older, they will become abstract thinkers. So what's the difference between abstract and concrete? Well, if you tell a little one that their person has died, or their person has died and went to heaven, then they may be like, okay, so when are they coming back? Because everything that they've known in this world up until that point is say that their dad died and ev- he's gone or he's left or however they word it. And he's done that before. He's gone to work. He left on a work trip and he always came back. So the concrete thinker in them is going to be like, okay, he's gone. When is he coming back? So the first point of round this is that we really want to work on the language we're using. And when we talk about dead or death, what are we saying? Our culture has so many euphemisms for the word dead. And if you look at those euphemisms for the word dead in the lens of a concrete thinker, they actually become kind of funny. So what do we say? What do we say instead of someone has died? So I know in a hospital, for example, they will say that the patient expired. All right. So that's kind of common, commonly seen. But what does expired mean to a 3-year-old? Well, what else is expired in their life? They hear their adults say, "Oh, the milk is expired in the refrigerator. It smells awful. I can't drink this. Tastes bad." And you pour it down the drain. And what do? You buy a new gallon of milk. So, and food is a great example of what has expired. So the young child's understanding of the word expired means it's something that is no longer good. You throw it out and you replace it with a new one. Another frequent one is that the person has gone to a better place, which has a number of things mixed up into it. One, most families that have had a person who has died, although they may believe that after you die, you go to a better place or you go to heaven, the understanding in a concrete world, in a concrete thinker, is that where's a better place other than here with me? Like, what do you mean there's a better place? Like he chose to go to a different place other than being with me. So that actually may not bring comfort to a griever in that idea. And so again, we're going to be careful with our language. Sometimes you hear that the person has been told that, or the child has been told that the person went to sleep forever. That is particularly problematic because what happens when a young kid goes to bed at night? They go to sleep and then they wake up and they keep going. So now, if a 3-year-old is told that their dad went to sleep forever, what you might start to see is the child not wanting to go to sleep at night because they know something bad has happened, even from the faces around them or the way, the grief and the tears and all of that, but they don't quite really understand that what dead is and the permanence of it, but they know now it's tied to sleep. So they're not going to sleep. So that's probably another one on the list of things we really don't want to say to little ones about how a person died. And then there's other things like, oh, they bit the dust, or they're departed, or they kicked the bucket. So with some of those, that's very concrete. Well, what did they kicked a bucket? Why did they kick a bucket? Did it hurt their foot? Like, what exactly does that mean? Which clearly does not indicate anything that the body has died. So phrases or things that are said off to the side like that are not very helpful. Ideally, we want to use the word died or dead. I do know a lot of people will use the word passed, that the person passed, which is an okay word to use. It just doesn't really describe what happened exactly to a concrete thinker. Because what does past mean in their world? I passed the ball to someone else, or I had an opportunity to talk and I passed. It's just not super clear. So, what we work towards is helping the word dead, using the word dead or died as very concrete. And then you need to even educate around that. So, the next element is how and what does dead mean? So, in that case, we're going to talk about the difference between dead and alive. So, what makes someone alive, right? So, I'm alive because I can breathe, my heart is pumping blood, I can see, I can feel, I can taste, I can hear, I can move, I can talk, I can sing, I can play, I can think. All those things are the things that make my body alive. And when a body dies, all of those things stop. So if you are at a place, like if you're at a funeral home, there's something very concrete, especially for the concrete thinker, to see a body that is not breathing, their heart isn't pumping blood, and knowing they can't think, they can't taste, they can't see, they can't smell, they can't move, they can't feel, they can't sing, that the body has died. And if the family's belief is that the person has gone to heaven, then you tie that in with their body has died, but their soul or their spirit has gone to heaven. So differentiating those two, which in the long run is going to make more sense if then you take the body and bury it or cremate it. That's because the soul or the spirit is no longer in the body. So using that concrete language really helps them to best understand death and how we talk about that, about how people die. There's three reasons how people die when you're talking with a little kiddo. One is that they are very, very, very old. Two is that they are very, very, very sick. Or three, they are very, very, very hurt. You always want to use all of the varies because that will differentiate between I'm just a little bit hurt because I got a paper cut or I stubbed my toe and being very, very, very sick. Those are very, very, very hurt. Very different things. So you can differentiate that. Just about every death that I've heard about can come into one of those three categories. When you first introduce the topic of someone having died to a child, you want to do it simply with age appropriate language and not too much information, right? We're not going into huge detail. We're small bits of pieces. And as they start to understand that, I would ask the child to ask if they have any questions. And then allow them to see where you go. And then the next day they might come and ask again. And then you might have to explain it again. So you start at that same place. And over time, as that child starts to understand like a body has died and what that means, they might go to, okay, so the person had cancer. Well, cancer was in the body. Well, what does that mean? What is cancer and how does it affect? And those are the questions that we as adults are here to help them understand. And for a young child, that might take some time. And that is okay. That is normal childhood development. So when we are overall looking this, if you're sitting down and talking to a child about someone who has died, you want to make sure that you're in a safe place. There's not too many distractions. Maybe they have something that they can hold on to or play or hug with. That's all okay. That there's loving, caring people around, hopefully, that can support you and support them and just give them the facts as you are able to do. Also, if there isn't a death occurring and you have a moment for like a teachable moment where maybe your family goldfish dies, right? There hasn't been a person who has died in your world, but there's some smaller elements. Maybe they're watching TV and someone dies on TV or in a TV show, and you can talk about that with them. And then you can start to do some grief education, some education about death and dying with a child at that time. Just help them understand. Or as I said, the goldfish, when the goldfish dies, maybe it's just a conversation about how the goldfish was alive when it was swimming and how the goldfish is now dead and the body has died. And then make choices as a family of what you want to do with that. So, do you want to bury the goldfish? Do you want to flush the goldfish? Like, what are the things that might work? Do you want to have a little memorial service and honor and remember the goldfish and talk about how you love the goldfish and you'll miss the goldfish? So there's a lot of opportunity um, to educate, and there's a lot of tools to do it out there. There are a few books that we use at Sandcastles. One is called Why Do Things Die? It's by Katie Danes, and it's like a lift the flap book from Usborne, and it's a really simple book that talks about why do things die? Is it okay to talk about dying? What happens when someone dies? Can I shout and cry and hide away? And how can I stop being sad? And then it ends with happy memories. There's another book we use called When Dinosaurs Die. This flip the flap you can use even for younger kids and preschoolers. And When Dinosaurs Dies can go up even a little bit older than that and include those kids too. It has great questions. And I always recommend for every book that the adult reads it first. If you don't need to read the whole book all at once. You could read certain pages. You can pick the ones you want to read. It's just a really great tool to talk about death and what that means. So at Sandcastles, we also do grief consult calls. So if you have questions or need resources or just want to talk more about this topic and figure out how to share something with a child, please feel free to reach out. We are here to help and happy to do so. So hope this helped a little bit in the words of how do we talk to young children about death. And until next time, have a great day.